Everyone should have access to basic health care and life-saving medicine, but that is not the case in some parts of the world. But there are people in both public and private sectors partnering to use technology to improve access for patients in many African countries. Hi, I'm Victor Barnes, Chief of Connected Planning at Anaplan. I lived in South Africa while working as an executive for a global beverage brand. So, I understand the supply chain issues that come with distributing products across such a vast continent. But what I was doing was not a matter of life or death. What we're talking about today is ARC, the Africa Resource Center, is a nonprofit organization that works to improve the availability of medications and other healthcare products across the continent. They do this by bringing people and resources together to solve critical supply chain issues. ARC works directly with the ministries of health in countries with the greatest need. ARC was recently granted access to a digital workplace through Anaplan Helps. That's a program where we make available for organizations designated as crisis responders. They get to use our platform for a limited time to help mitigate the COVID crisis. Typically, Anaplan Helps makes our planning software available free for 90 days. But thanks to a partnership with Deloitte and Johnson & Johnson, ARC can use the Anaplan platform for the next 2 years. What this will mean for improving access to critical medicine is what we'll discuss today in this episode of Stand Out. Joining me now from Cape Town, South Africa, is Priti Mubaiwa. She is the Strategy and Organizational Development Analyst at ARC. Priti, thanks for joining me today.
It's a pleasure to join you too, Victor. Thank you.
Whenever I meet people who are new to connected planning, I always want to know what it was that led you to conclude there was a need for a better planning system. Like, what was the real unlock that led you to choosing a SaaS product to leverage more technology to improve ARC's support to ministries of health in Africa's supply chain strategies?
To understand what was the unlock for us, it's also important to actually understand the work that ARC does, which is we support ministries of health to strengthen their supply chains sustainably and also to achieve their strategies and goals by strengthening six of their supply chain elements. And I can talk about these elements, which include developing their strategies, improvement roadmaps, governance, solutions, proposals, policies, and research, as well as budgets and investment cases. So when we look at supply chain at ARC, we look at it very holistically. And our unlock in South Africa specifically came because we are trying to build a robust system that is supported by connected planning.
Priti, describe for me some of the challenges you're trying to overcome with connected planning.
With some of the countries in Africa, we've kind of noted that some countries lack a strong supply chain processes. They lack a strong and effective policies and procedures to manage their supply chain. And as you can imagine, these ineffective demand and supply planning actually lead to medicine shortages and stockouts. And sometimes, this is actually when there's medicine shortages and stockouts, it's actually literally a question of life and death for some people.
As you were talking about that, a thought I had in my mind is whether or not there are or have been underutilized supply because of the misalignment of supply and demand.
So expiry is also a very big challenge for governments, ministries of health in Africa, because if you aren't able to understand how much you be supplying and and matching that to the demand, it means that for some medicines and some products there's an oversupply, and then for some medicines then there's also like an undersupply, and for the ones oversupply they're going to expire in the warehouse and they just sit there, and that actually results also in massive financial losses as well.
Tell me why you think it's important to have the private sector involved in the public health supply chain in Africa?
Every time you go to the most remote part of Africa, you are able to find basic goods such as, soap, you find cooking oil, you find, maybe things such as washing powder, you find pads for women. And these are products that are obviously, they've gone through a supply chain and to be delivered to one of the most remote parts on the continent, and still you can find them. And so, when we look at what the private sector does and their ability to reach that last mile, there is definitely something that we could learn, or that the public health supply chains can actually adopt in order to get things right. Because, if the private sector is managing to get the very basic goods to the last mile, why can't the government also, provide the same services and also medicines and health products at the very last mile?
Talk to me about how supply chain shortages can adversely impact medical outcomes or even life expectancy for patients.
Simply put, it is the difference between life and death. Because let's say you go to a to a health facility and you need certain medication and you're unable to find it, and maybe that was the medicine that was going to help save your life. It means that we've lost a life. And so it's not just, it goes even beyond just not finding it and maybe coming back the next day to find it, because if you don't find it on day one, you might actually die. And so this is why at ARC we are also very passionate about being able to strengthen these supply chains to be able to support governments to get the medication and health products where they needed and when needed as well.
So our conversation has me wondering, will ARC be teaching these health ministries how to use connected planning as well?
So yes, we have already held another concept demonstrator session in Namibia. And as with the way that we work, we not necessarily, sell governments certain solutions, but we do encourage them to learn from what other countries have done that has been successful. And so, with the concept demonstrator, we will be sharing it with other countries and see how that goes.
Pretty, it has been so wonderful speaking with you. Thank you for your time, and congratulations on earning and completing your PhD just a short month ago. Thank you again.
Thank you so much, Victor. It's been a pleasure, and we are thankful for the opportunity to share some of the work that we're doing in Africa.
If you want to learn more about Anaplan Helps, the program that makes our platform available for a limited time to organizations helping with COVID-19, visit us on our website. Be sure to follow us on all our social media platforms and join me again as I talk to leaders looking to stand out using connected planning.